Hi, I'm Dr. Leslie Stewart of Adult and Pediatric Dermatology, and today we're going to be talking about a cosmetic procedure known as chemical peels. A chemical peel involves application of an acid to the skin, and therefore it will result in peeling or exfoliation of the outer layers of skin. Chemical peels are used to treat various conditions. Some of those are acne, mild wrinkling or photo damage, shallow acne scars, and irregular pigmentation due to sun exposure, for example, sunspots, freckling, and or mask of pregnancy, otherwise known as melasma. Chemical peels should not be used to treat very lax, sagging, or loose skin, very deep wrinkles or very deep acne scars, spider veins, and it cannot change the size of the skin pores. The depth of the peel depends upon the type of the acid that is used. A very superficial peel, sometimes people call it lunchtime peels, create a very superficial peeling and may only cause a little bit of redness and peeling for a few days. Medium depth peels are stronger peels that may cause much more redness, more peeling, occasional scabbing, and small blisters. However, the stronger the peel, the better the results. So now we have a patient here who is going to have a chemical peel to treat some of the irregular pigmentation and sun damage on her skin. For best results, the treatment area must be thoroughly cleansed. All makeup must be removed, and the area is degreased using a 100% pure acetone solution. The chemical peel is now applied to the area, usually the entire face, and one is careful not to get into the eyes itself. However, under the eyes and even the eyelids can be treated in certain circumstances. The skin will start to burn, and a fan will be given to you to help cool the skin. After the treatment, the skin will appear pink or red, and even a little frosting can occur. Before a chemical peel, one should avoid topical irritants such as topical alpha hydroxy acids, otherwise known as glycolic acids, over-the-counter benzoyl peroxides, facial scrubs, retinoids such as Retin-A or Tazorac for at least 5 days before a peel. One should also inform your doctor if you have a history of cold sores or fever blisters, as you will need an oral medication to prevent a cold sore or fever blister after the procedure. One needs to wait 2 weeks after waxing, hair removal treatment, fillers, or botulinum toxin. You cannot have a peel with an active infection, and the infection has to entirely heal before one can have a chemical peel. Chemical peels are usually performed in a series of treatments, usually 4 in number, and they are performed usually every 3 to 4 weeks. Over the next few days, redness, peeling, a little scabbing, or small blisters can even be seen. After a chemical peel, one needs to avoid prolonged sun exposure for at least 1 week after the treatment. One needs to apply a broad spectrum sunscreen daily with a minimum of SPF of 30, and it's best if it contains a physical blocker such as zinc oxide. One will also want to avoid harsh washes, astringents, toners, and again, irritating products containing glycolic acid, alpha hydroxy, salicylic acid, retin A, benzoyl peroxides, or other exfoliating agents or scrubs for at least 1 week. One will also want to frequently moisturize the face, and one should also refrain from getting fillers or botulinum toxin for at least 2 weeks after treatment. And that also goes for waxing, electrolysis, or other hair removal treatments.